Most health facilities in Gauteng will be affected by the ongoing Nehawu strike. It's accusing government of arrogance during negotiations. Workers affiliated to the union have been protesting since Monday. The union demands a 10% wage hike, but government is offering less than half of that at 4.7%. What plans are there to ensure that patients are attended to? We're joined by the Gauteng Health MEC, Nomantu Nkomo-Ralehoko. Thank you so much for your time, MEC. We do appreciate it. I'm sure you are very stressed at this stage. Nehawu is not backing down. They are planning to intensify their strike come tomorrow morning, and we do know that most healthcare facilities in the Gauteng province have been affected.
Yes, Ada, indeed, was stressed, but what we have done is to meet again with the management of the Gauteng province. Besides that, you know that this is a national strike. On Friday, we had a discussion with the provincial office bearers of Nehawu. And then this afternoon, again, we met with all unions in anticipation of getting things worse, indeed. And we all agreed that we are going to respect picketing rules going forward in our institutions. And we agreed on maintaining minimum service standards at an institutional level, was one to ensure that essential services and non-striking workers can be allowed and be protected if they want to come to work. And we have since got again assistance from South African Military Health Service for Telemweran. You remember Telemweran is Gauteng and Bekimlangen were the hardest hit and were unable to operate in some of the areas. Then they arrived yesterday, started at Tele, and tomorrow they will be at Beki and Gauteng Hospital to assist where there is a need. But we do have even volunteers in the community that are assisting in cleaning the hospitals where we have a problem. And we have since got assistance. Again, we note and we appreciate and the improved levels of services, as most of staff did return after our Friday meeting with the provincial office bearers. They did return to work. And then this afternoon, even yesterday, we're monitoring the situation, and we will continue monitoring that and ensuring that where we have a problem, at least there is some work that we are doing. We have a command center that we have opened as a the CEOs in all the hospitals, so that where there is a need, we immediately intervene in specific areas. And we hope that even if they do come to work tomorrow, but there will be that level of understanding that we have agreed upon of respecting each other. They do have the right to strike, but at the same time, we must make sure that we protect those vulnerable patients that are in our hospitals.
Yes, certainly.
And we're expecting
Yes, I'm so sorry to interject there, MEC, but you know, it's great to hear that you have this command center, you're bringing in the military health to assist you, but it seems as though the union says that they won't back down because they feel as though government is arrogant in its negotiations, and we do know there are currently various meetings underway to try and find a solution to this. We also know there's going to be a Labour Court judgment tomorrow as to whether or not Nehawu can continue with its strike. But surely this is stressing you out, because we do know, according to the Health Minister, that there have been 4 deaths possibly linked and directed to the shutdown and the strike that we have been seeing. Are you worried, despite the measures that you have put in place as Gauteng Health, that things could possibly get worse tomorrow?
Definitely we are worried, but we know that the National is busy with the negotiations because they had to go back to the table again, and I'm sure they will have to come up with a solution based on some of the things that we don't want to happen. But in the province, we have our own negotiations. Hence, I believe that our own discussions, because as we have been having the cordial relationship with the workers in the province, it will not be that much hectic as it will in other areas. And that's why this afternoon's meeting, I'm confident that we will be maintaining that relationship, that let's work together, let's ensure things go according to what we have planned. We are not doing things that we'll all regret after the strike, because at some stage the strike will end. But when the strike ends, they must end without us being hurt as a province, all of us.
MEC, what happens to workers that are not part of this strike and want to go and be on duty tomorrow? We have seen that some workers that have opted not to partake in the strike have been threatened and intimidated.
We have agreed that those that are not striking must not be denied any access to the facilities, and they are also not. They must be allowed to go to work, and that was the agreement. So we will definitely protect them in areas where the environment is hostile. We will definitely plead with the workers not to come, but we'll make measures to ensure that we protect the workers so that they are not being victimized. But even ourselves, there is a team in every hospital. There is a management team that is there, starting from the one that is in the hospital, the province and the national. They are national officials, because the DG, Dr. Butelezi, and our acting HOD, Mr. Malotane, they are working very closely together. So anything that we do it with the national, because we don't want anything to happen. And I think the relationship, it has been working very well. And I'm happy that we have put up contingency measures to ensure that where there are serious affected hospitals, those plans are in place. We activate them immediately, as we have done last week, because I think it's the first day that we were hard hit, because immediately after the first day, when we had to sit down and plan properly, we had to have a catch-up program where we have to make sure that where we're supposed to open up a theater, because most of our theater in these 3 hospitals are closed. So we've taken those patients to other hospitals to do the operations.
So MEC, sorry to interject. I just want to ask, so yes, you've mentioned 2 specific hospitals, Bheki Mlangeni and Tele Hospital, that have been mostly and hardest hit. So if you're telling me that
don't forget, there are 3. It's Sebokeng. In fact, Sebokeng was completely shut down one of the days. I think it was Wednesday. Sebokeng, Telemwerane, and Bheki Mlangeni. So those were the hardest hit. Others, there were pickets outside the gates of the hospitals. We remember even at Barra, there was a picket. And again, we have agreed that there must be specific areas where the workers can go and picket on, so that they are not obstructing the entrance of every hospital. Even Kopanong, there was some pickets that were done in Kopanong. And that's why I'm saying to you, Ada, we have the contingency plans that are in place. We're checking hourly what's happening there, and that we have deployed officials in those hospitals that are working with the CEOs and executive management in every hospital. Charlotte McCrack, if you remember, the same, we were negatively impacted on the first day, because you remember, the biggest hospital where we do some of our work and our operations. Then the following day, things became normal. If you remember, Minister was here, and we were able to have a situation that is normal immediately at Charlotte McCrack after the negotiations and the discussions that were done.
Okay, so you said something that's rather worrying, and maybe I didn't hear correctly. You said that there were theatre sections from specific hospitals that were completely shut down. So that's worrying. Which hospitals are those? And do you have enough capacity and staff to help them and accommodate them at other hospitals?
Yes, it's Bukeng, it's Telemwerane, it's Bheki Mlangeni, and Kopanong. But we have enough staff, because the staff that was supposed to do the operations at those hospitals, we've rerouted them to go to the hospitals where we've taken patients to. So at least now we are able to operate. And in most areas, it was the maternity, including the maternity wards, that were closed in some of those of the hospitals that I've indicated to you. In fact, it's Tele that is completely shut down, the maternity hospital. So we have to reroute those patients to go to Pethakoa, to go to Tambo Memorial Hospital, to go to Barra. So at least we do have that, because when the patient goes, the patient is followed by the doctor. And at least there is capacity that we're beefing up in those hospitals too, because doctors were allowed in most hospitals to come in and do the rounds and work and check the patients. That's another thing, Ada. That's why I was saying to you, the diversion to these hospitals, at least it was done on the hospitals that are not far, that are nearer to each hospital. And we have in Gauteng a clustering system. We have clustered our hospitals. We will find cluster 1, cluster 2, so we take them and group them. So they are working together in terms of that. So because if we have a shortage of linen, we'll quickly get the linen whilst they were still organizing the other linen. So we have not been hit hard, I think, in those areas in terms of napping. Because remember, if we are unable even to assist them with some of the things, we will definitely be in a serious crisis. But at the moment, we've managed to manage that this week. But our worry is next week, although we have plans in place, contingency plans in place, with that command center that we have now. At least now, tomorrow, we know what we must do in any hospital that will have a problem. Yes.
Okay, thank you so much, MEC. It really does sound worrying, and it's, of course, unsustainable. We'll just have to wait and see what comes out of that court judgment, and we will be speaking to Nehawu in this half hour. We wish you all the best, because it does seem like it's going to be quite a concern. That was Gauteng Health MEC speaking to us on their plans here in the province.